The goals to be accomplished in genital reassignment surgery, male to female. The ideal results to accomplish with genital reassignment surgery in the male to female individuals are as follows. 1. The appearance of external genitalia should be very authentic. The labia majora, the external vaginal lips, should be correct in size and in length and join in the midland appropriately above the clitoris. The labia minora should be small and correctly positioned. The vaginal opening should not be gaping or too open, and the neovaginal lining should not protrude or prolapse to a point beyond the labia minora. 2. The vaginal opening and width should be appropriate. To be able to place 2 fingers, the index and the middle finger, as does the gynecologist when conducting a pelvic exam, is an appropriate width. A 6-inch depth is quite adequate as well. There should be no shelf, no directional deviation, and no closure or stenosis at any point in the neovaginal length. The vaginal angle must be correct for comfortable sexual relations. The vaginal opening should not be too narrow or restricted, stenosis, in the late convalescence period. 3. The vestibule shall be sensate. This means that the neovaginal opening should have sensitivity when touched and lead to erotic feelings and response. This is the same sensation that should result when the neoclitoris is touched by the partner's tongue, fingers, or penis. 4. As time goes on with healing, there should be less and less difficulty with the neovaginal draining or discharge, and there should be no bleeding or spotting either spontaneously or after a sexual experience. 5. In the long term, there should be no loss of vaginal depth, no vaginal protrusion or prolapse, and no vaginal stenosis at the opening or at any point in the entire length of the vagina. Very importantly, urinary function should be uncomplicated. The urethral opening must have the proper relationship to the structures around it, which means that it should be placed appropriately at the time of the primary surgery. There should be a proper direction of the urinary stream and no evidence of urethral narrowing or closure, stenosis, which would cause urine to spray or to be misdirected. Urinary infections should not be frequent for any postoperative person. While these infections can develop spontaneously on uncommon occasions, or can take place after sexual relations, this should be an uncommon occurrence.